Welcome back. In this video, we're going to look at how to explain your theory of change in a short pitch. You see here, I had the great privilege of working with an NGO in northern India called the Urban Health Resource Center. And the goal of this nonprofit was to help women in the poor communities in cities in northern India organize for things like public health and sanitation and economic opportunity. My job was to help document their stories and best practices. And I think these are some of the most creative and effective organizers I've ever met in my entire life. And I want to tell you a little bit about the theory of change behind one of their local campaigns. So this was a campaign in Agra, a city with the Taj Mahal, one of the most famous buildings in the world, but with also poor neighborhoods with a lot of horrific poverty, including a lot of child mortality, infant and child mortality. And so these women decided that what they wanted was to make their community a healthy and happy place for children. And that was a measurable outcome, a measurable impact that they wanted to create. You could measure it in lowering infant mortality rate to less than 15 per 1,000 births, which would put it in line with more wealthy areas of India. And in the well-being of families that feel like they have access to the care that they need. And that's something that could be measured in surveys to show how we're making progress over time. So what did they think would help establish that we are getting closer to that impact? Well, they looked at these intermediate outcomes of access. In this case, they set their target as 90% or more of mothers in these poor neighborhoods having access to care, to the trained medical professionals, and more than 90% having access to good information, knowing and using good health practices. And so they said, okay, well, how do we get to that outcome? And then they brainstormed about different activities, and they decided that the activities that were most effective to improving access and improving the information, first they had to gather data, right? They had to know where the families were that needed this information. And they built this wonderful community map using the bindis, the little colored dots on their foreheads that they used to show the number of children and the different households in their communities, and this way to gather data to show which families needed the information when. Then they planned workshops, right? How could we get the right information to these mothers in a timely way so they could use it as part of the process of preparing their pregnancy and preparing the birth of their children. And they could measure how many new mothers or expecting mothers could be trained in a series of workshops. Then they had a transportation issue, and so they figured out how could we organize this was before downloadable apps, but something like a ride-sharing service to help women who needed transportation to the hospital because the high-quality hospital was far away, too far to walk, and that by creating this ride-sharing system, they could help transportation for 1,000 families who needed transportation over a 1-year period. And then finally, to create more infrastructure, they needed to create more clinics closer to these women. They needed to engage in lobbying and face-to-face advocacy to members of the local and regional health and budget ministries to be able to unlock the resources to get medical facilities closer to these women. So this was their theory of change. And the drivers that they identified in order to make this theory of change work, they needed to be able to communicate with medical professionals to at least get the best information and bring some trained doctors into the community to run these workshops. They needed access to elected officials to be able to lobby for more resources and more facilities, and some modest funding to be able to pay the salaries of the community organizers who helped these women with their initial steps, with their strategy, with their planning and their operations. And then there were internal drivers like the kinds of expertise to get the right information to the right place. if they were, they were thinking about building, a website and applications later that would help create this service. So that would be another kind of expertise. And then, of course, their relationships. That was a key driver of being able to have these workshops. They needed people to trust them in their community. And so they did things like going to weddings and going to marriages and other community celebrations to talk about their campaign. And so people knew about it and were more trustworthy, more trusting of the events that they planned. And of course, operational things like spaces for their workshops and food, etc. So this, in one slide, you see the theory of change that was the basis for this entire multi-year campaign. So how could you explain this if you were thinking of pitching this to a potential funder or potential ally? So here's the steps that I recommend going through, right? You begin by talking about the impact you want, then what's standing in the way, the barriers. Then what I recommend is a 1-sentence, maybe 2-sentence summary of the theory of change, of the strategic insight on which all of your activities are built. Listing then some of the activities and what each of them contributes to that theory, and finally what you need and a call to action to be able to execute. So in this case, one of the leaders of the public health campaign might begin a pitch by saying, "We believe that every child in our city should grow up happy and healthy, no matter the income of their family. But too often today, new mothers in our city don't have access to reliable information or trained medical professionals. If we can bring trained professionals with high-quality information directly where these women live, we can reduce infant mortality. Our association is planning a series of workshops where we will train mothers in prenatal best practices like iron tablets. If we execute our plan, within 2 years, more than 90% of women in our community will be able to know and use these practices to keep their babies healthy. We're looking for help with transportation to help these women assemble for the workshops. Could you support us?" Right, so you see, just in less than 1 minute, a very clear explanation of the impact they want, what's standing in the way, what is the key insight on which their campaign is built, what are the activities they're planning and what will that produce, and finally, a key call to action. Okay, let's think of a different example now. Imagine we are an NGO planning a campaign for pay equity between men and women in Nigeria. And we've done our research and we see that the gender pay gap today is more than 60%. And we think that if we can get the right conditions in place, that we set a target of we want it to make it less than 20% by 2035. And of course, if we find out that this is not the right goal, this is not the right target, we can obviously come back and revise it. But let's say this is our first version of our theory of change, and we think that this is a reasonable, feasible, achievable goal over the next 10 years. So then we ask, what do we need in order to reduce this gender pay gap in Nigeria? Well, we look at all the possible options. We think, well, one piece of this is legislative. We need a stronger law with enforcement mechanisms that require companies to pay the same salary for the same level job, whether it's a man or a woman. We also need better data. So we imagine an outcome of better transparency and accountability, meaning better audits where companies ideally voluntarily publish data on what men and women are paid in their sector. And then finally, we think, well, this is not just a legal thing. It's not just a data problem. This is a attitude problem. We also need, in addition to law and data, we need to make it unacceptable in our society for women to be paid so much less than men. So then we build a series of activities. Okay, so what are the activities that can get us to these three outcomes? Well, we need a plan to advocate and put pressure on the political system. We need to be able to draft a law that could help us in our context. So we need to get legal expertise together and develop the policy. We need a media campaign to build awareness that both the general public and specifically political decision makers. And how can we measure that media campaign? Well, we think we can get more than 500,000 views of our videos. we need to collect data about what the current situation is. So we need to these kind of data collection would help us create a better evidence base to change attitudes that we want to change through our media campaign. And finally, we want to engage companies directly and help them agree that this is a key issue. If they want to attract and retain the best talent, including women, that they need to publish this kind of data and make their place an attractive place to work. And so this is the kind of activity, a kind of a certification program that companies could opt into and that could create peer pressure. So what would make this work? Of course, we need be able to build these kind of partnerships. We need a certain number of corporations who are willing to take the first step. We need access to media. We need access to policy processes. And in environments where that access isn't there, this will make this theory of change very difficult. But if we do have that access, then this gives us reason to think that these activities are feasible, they could work. And then internally, what is the expertise we need? What are the spaces and resources we need? What's the funding we need in order to make these activities work? Right, so you see, again, in one slide, you have the basis of a strategy that we can explain to potential allies, potential funders, etc. Okay, so how might we explain this in a short pitch of 1 minute? Again, we go through these same 5 steps. First, the impact. Nigeria should be a leader in workplace equality, accelerating our economic development by fully utilizing all of our talent. Barriers. Today, the World Gender Gap Report ranks as 123rd out of 146 countries surveyed. Why? Because there are few incentives for companies to implement good policies on pay equity, and we suffer from a lack of good data on what male and female employees are really paid. Strategic insight. Our plan is to reduce our gender pay gap from 63% to less than 20% in 10 years. We can do this through equal pay legislation and enforcement mechanisms, as well as an improved culture of corporate transparency and accountability around pay. And now actions. And we just give one in this case. We have launched a corporate certification program for equal pay compliance. 20 Nigerian companies have already committed to participating in our pilot program. And now we imagine a call to action for a specific person. In this case, it could be a retired CEO in the energy sector. We could really use your support in building our relationships with energy companies to convince them to join our pay equity program. Will you help us? Right, so you see here a structured but still kind of conversational and direct way of explaining your theory of change. And in our next video in this series, we're going to look at an example of how a theory of change can evolve as you learn on the ground of what's working and what's not working in your campaign.